This might be one of the most important videos I've ever done. The worst I've ever felt. Dr. Fair describes what it felt like to contract COVID-19. This is one of NBC News' science contributor. After telling their audience how horrible COVID-19 was, a few weeks later found out he actually didn't test positive for COVID-19 and never tested positive for COVID-19. Seems bizarre, right? But we're gonna get into why later. New York Post, man who tried suicide by cop to avoid COVID-19 death succumbs to virus. Wait, what? A man who tested positive for the pandemic coronavirus and was fearful due to his underlying disease of diabetes and his weight of the virus decided to try to get killed by the police, ended up getting shot at 11 times, getting hit 7 times, dying 5 days later, and they said he died from coronavirus. How could these be? We're gonna get into it. This is straight off the CDC government website for antibody tests. Antibody tests are the ones that will test if you ever had COVID-19, not just currently, but previously. Right on their website, if you test positive, a positive test result shows you might have antibodies from an infection with the virus that causes COVID-19. However, there is a chance a positive result means that you have antibodies from an infection with a virus from the same family of viruses called coronaviruses, such as the one that causes the common cold. So right on the CDC website, they're admitting that a positive antibody test does not necessarily mean that you really have it from COVID-19. It could be another coronavirus or a false positive, as they call it. So this is really important. Are they counting those antibody tests towards confirmed or probable cases? Well, this was in the Los Angeles Times. Orange County inflated its coronavirus test numbers by mistakenly including antibody tests, officials say. But this is the thing. Orange County's not the only one, and they're not the only ones making that mistake. This was in Live Science. The CDC, the Center for Disease Control, is lumping positive COVID-19 viral and antibody tests together. Here's why that's bad. It was also in The Atlantic. How could the CDC make that mistake? The government's disease-fighting agency is conflating viral and antibody tests, compromising a few crucial metrics that governors depend on to open their economies. Pennsylvania, Georgia, Texas, and other states are doing the same. Let's read that article. The Center for Disease Control and Prevention is conflating the results of 2 different types of coronavirus tests, distorting several important metrics and providing the country with an inaccurate picture of the state of the pandemic. We learned that the CDC is making, at best, a debilitating mistake combining test results that diagnose current coronavirus infections with test results that measure whether someone has ever had the virus. And if you remember, straight on the CDC website, they're telling you even if you get positive for the antibody test, it could be a false positive. They're not even saying it's an accurate test. The upshot is that the government's disease-fighting agency is overstating the country's ability to test people who are sick with COVID-19. The agency confirmed to The Atlantic on Wednesday that is mixing the results of viral and antibody tests, even though the 2 tests reveal different information and are used for different reasons. Further in the article, this is not merely a technical error. States have set quantitative guidelines for reopening their economies based on these flawed data points. Several states, including Pennsylvania, the site of one of the country's largest outbreaks, as well as Texas, Georgia, and Vermont, are blending the data in the same way. Virginia likewise. Mixed viral and antibody test results until this week. You've got to be kidding me, Ashish Jha said, professor of global health at Harvard and the director of Harvard Global Health. How could the CDC make this mistake? What a mess. So once again, the CDC is saying if you test positive for antibody tests, there is a chance that a positive result means you have antibody from an infection with a virus from that same family of viruses, such as the one that causes the common cold, and they're conflating them with other tests. If this wasn't crazy enough, do you remember that story I covered before where New York City's coronavirus death toll soared past 10,000 when they added more than 3,700 people who had never tested positive for the virus but were presumed to have died of it? So how could you have never been tested for COVID-19, but they add over 3,000 people to the death list because they presume that you have it? How are they counting? Shouldn't you know? Shouldn't everybody know, considering the government is destroying millions of lives, destroying millions of jobs, furloughing people, closing gyms, closing small businesses, bankrupting thousands upon tens of thousands of businesses, ruining lives. People are getting out of shape. I get direct messages of people who have had 3 friends commit suicide. This is life or death for hundreds of millions of people, and you don't even know how they're counting, and most people don't. So please pay attention, or else you're never going to go back to normal because you don't even know the metrics they're using to shut down. And to be quite honest, before we continue, they don't even know the metrics they have to shut down. They've changed it multiple times. It's because we don't want to overwhelm the hospitals. The death count's too high, the cases count is too high. Okay, so now the case count is too high, because if you look at the chart, cases are going back up, but the deaths have been on the decline. So isn't that a good thing? Doesn't that mean the mortality rate's lower, more cases, less deaths? But to all the people fear-mongering about cases, let's get into how they're actually counting the cases. This is from Cleveland ABC, explaining how they're counting in Ohio. They're doing something called total cases, which is confirmed cases and probable cases combined. So a confirmed case is when you get a viral test and it comes back positive. But what's a probable case? Because they're adding that to total cases. Probable cases are cases that meet some criteria but have not been confirmed by a viral test. According to the CDC, there are 3 ways a case is considered probable. A person meets clinical criteria and epidemiologic evidence with no confirmatory laboratory testing performed for COVID-19. A person meeting presumptive laboratory evidence and either clinical criteria or epidemiologic evidence. A person meeting vital records criteria with no conformity laboratory testing performed for COVID-19. Alright, so that's a lot of confusing jargon. What does that actually mean? What does clinical criteria mean? It means you have 2 of the following symptoms, which is fever, chills, rigors, myalgia, headache, sore throat, new olfactory and taste disorders, or at least one of the following symptoms: cough, shortness of breath, or difficulty breathing. So if you have a cough, you've reached clinical criteria. All you need is a cough or a fever with a sore throat or a headache with a fever or a headache with a sore throat, which can obviously be dozens of other illnesses. Everyone knows that. But just a cough or a headache and a sore throat, and bang, you have the clinical criteria for coronavirus. So if you remember, all you need is clinical criteria and epidemiologic evidence. So now that you know the clinical criteria is literally a cough or a sore throat and a headache, what's the other evidence? Epidemiological evidence or linkages are defined by the CDC as 1 or more of the following exposures in the 14 days before onset of symptoms, close contact with a confirmed or probable case of COVID-19 disease, or close contact with a person with clinically compatible illness and linkage to a confirmed case of COVID-19 disease, travel to a residence in an area with sustained ongoing community transmission of SARS-CoV-2, member of a risk cohort as defined by public health authorities during an outbreak. So let me get this straight. You just have to be in close contact with somebody that you think had coronavirus, or in an area where people had coronavirus and a cough, and they'll tell you have COVID-19, or a headache and sore throat or chills and a headache, and in close contact with a probable cause of COVID-19, and you combine those 2, that means you have the clinical criteria and the epidemiologic evidence, which means they're allowed to say you are a probable case of COVID-19 and add you to the total cases of COVID-19 despite the fact that you've never even had a test, and there's a decent percentage chance that you don't have COVID-19. So what are the other criteria that I told you? Okay, so then what's vital records criteria? Is just a death certificate that lists COVID-19 as the cause of death or a significant condition contributing to the death from the same article. So for real, does Ohio count antibody tests in its reporting? Yes, antibody tests are counted among the probable cases, which are added to the total cases. So if you've gotten a message from a friend like I have and many people have that said, I just got diagnosed with COVID-19 and I never even had a test, that's exactly how. Most people don't know this. Most people have no idea how they're counting. Most people don't know that they're doing unprecedented amounts of counting, millions upon tens of millions of tests. So the more you test, the more you're going to find it. The looser the tests are, the more you're going to have it. When you can say thousands of people are dying from COVID-19 when they never even had a real test, of course the deaths are not going to go down. And even when they do go down, they're going to point to another metric. And when that goes down, they're going to point to another metric. And when that goes down, they're going to point to another metric, like they've been doing since March, and then April, and then May, and then June. And every reason that they told us from over-hospitalizations didn't happen. They didn't give freedom back. And then they said, well, the death count's too high. And then they protested. And then they said that their protest, they were writing in their articles that experts were saying, because it's a Black Lives Matter protest, we think it's actually healthy. But, you know, the right-wing anti-lockdown protests are really unhealthy. But when we go in the streets with thousands upon tens of thousands of more people, we're trying to justify why that's okay. And then the cases spiked, and then the deaths declined, and then they did their PR to say that they had nothing to do with it, and they shut down small businesses, and they're keeping open major retailers. In some cases, you have them not only closing gyms, but closing hiking trails, despite the fact that millions of people have already been confirmed or probable with COVID-19. So you're going to stop a spread of a virus that's been around already? You're going to slow the spread of a virus that's already How are you going to stop it? How are you going to slow it? Have we ever slowed the flu? It's been around for most of the last century. We've had a vaccine for it for over 70 years. Did we slow the spread? Did we stop the spread of the flu? Does it disappear? The flu's never disappeared. The common cold hasn't disappeared. So why in the world would coronavirus disappear? And how are they counting? I just told you how they're counting. Does anybody care? This doctor cares. He says, so if you get tested for COVID-19 3 times and are positive all 3 times, should it count as 1 positive test or 3 positive tests? This is important to consider when you hear these huge numbers. It is important, but is anybody asking those questions? Does anybody know? Does anybody care? What would happen if we did a running toll of the flu or a running toll of the common cold and tested as aggressively as we're testing, tested as liberally and loosely as we're testing, and defined a COVID-19 death or a probable case as loosely as we do with COVID-19? What would happen?
So that means that if you were in hospice and had already been given, a few weeks to live, and then you also were found to have COVID, that would be counted as a COVID death. It means that even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that that was the cause of the death, but they had COVID at the time of death. I hope that's helpful.
Most people don't even know how they're counting the deaths. Anybody with COVID-19, including people with how I just told you they diagnose it, anybody with it, they're saying died from it. Even Dr. Birx admits this.
We've taken a very liberal approach to mortality, and I think the reporting that if someone dies with COVID-19, we are counting that as a COVID-19 death.
Can you be sure? I mean, you hear from coroners that that's not necessarily the case. Or are you sure? How can you be confident about that? And is there any concern that it skews?
This is a huge deal. How much destruction are you going to do? How much chaos are you going to create? How much civil unrest? How much economic, financial, mental, and physical destruction and trauma are you going to force the kids through? Force the people of this country and the world through? When does it end? There's no expiration date at this rate of how they're counting. And the media coverage has just been absolutely biased and disgusting. For example, you hear so much about Texas and Florida and Florida and Florida. They hate Florida so much because it's a Republican governor. But if you look at the most recent numbers from Florida when I made this video, in Florida and Texas, you have more people than in New York and New Jersey, but look at the death rate. There's over 32,000 people in New York, over 15,000 people in New Jersey, and over 4,000 people in Florida, and you're gonna act like Florida's the big scoop? There was a huge scandal in New York and other cities where they put COVID-19 infected patients into nursing homes, and a lot of the deaths were in nursing homes, and nobody talked about it because the Democrats control the media, and they just demonize Republicans and Ron DeSantis and act like they're doing nothing wrong. It's disgusting. People hate the president of the United States so much they're literally willing to do anything. And if you think I'm exaggerating, here's a video of insufferable liberal Bill Maher saying the other year that he would prefer the economy to collapse just so they could beat Trump in the election because they knew they couldn't beat him with a good economy.
Can I ask about the economy? Because this economy is going pretty well. We have to, what? Why is that funny?
It is going well for now.
For now, right. That's my, thank you. That's my question. Is like, I feel like the bottom has to fall out at some point. And by the way, I'm hoping for it because I think one way you get rid of Trump is a crashing economy. Yeah. So please bring on the recession. Yeah. Sorry if that hurts people, but.
So when does this end? Where does this stop? Educate yourself with how they're counting. This will never stop. Doesn't matter if you're liberal, progressive, Democrat, Republican, independent, or libertarian. If you don't have a clarity of information, how is the CDC counting? How is your state counting? What are they considering a death? What are they considering a confirmed case? What are they considering a probable case? How authentic is the data? If you don't realize this, they're going to keep moving the goalposts and keep changing this stuff. And the amount of devastation, I'm not just talking about economic, I'm talking about physical. I'm talking about mental, traumatizing the kids with all this nonstop fear mongering when we know that fear lowers the immune system. This has gone too far. So please think about this. Please educate yourself. Please share this video and please tell other people before we dig ourselves in such a deep hole that we'll never be able to get ourselves out of. And not being able to question that or consider that or go against the grain of what mass media is pushing out is not virtuous or pro-science. It's fascistic, it's authoritarian, it's Orwellian, and it's going to prevent solutions and better arguments from rising to the surface because this is the time we need them. God bless you, God bless your family, God bless America, and God bless the world. Have a beautiful day, and I'll be back with more videos very soon.